Welcome to the American Society of Plastic Surgeons Roundtable panel discussion. I'm Caitlin Clark, and I'm joined by three esteemed plastic surgeons and ASPS members. Dr. Jonathan Bank is a board-certified plastic surgeon who practices in New York City and focuses on breast and body contouring procedures as well as microsurgery. Dr. Amaka Wuba is a plastic surgeon in Nashville with a focus on aesthetic surgery of the face, breast, and body, as well as breast reconstruction. She is very involved in research, education, and mentorship. Dr. Michelle Shermack is a board-certified plastic surgeon with a practice in Baltimore. She also serves as vice chair of the ASPS Public Education Committee. And today, we're here to discuss how to combine multiple procedures into one surgery. Dr. Shermack, let's start off with why a patient might want to add more procedures into one surgery.
So that's a really good question. And I would say that, you know, there's a lot of people are so busy today, and I find that a lot of our patients just want to, they know what they want, and oftentimes they want several things, and it's just efficient for time management. It's actually cheaper to do combination procedures. I always say it's kind of like one long nonstop flight instead of like two direct flights. So, you know, financially it makes more sense. Plus the recovery of various procedures, like probably our most common combo is a mommy makeover. So doing something with refreshing the breast area and doing a tummy tuck, maybe some liposuction. And basically, you know, I always say, you know, the breast surgery might be 2 weeks recovery. The abdominal surgery might be 2 weeks recovery, but that doesn't mean it's going to be 4 weeks if you do it together. It might be like 2.5. So I'd say just, you know, we're all so busy and we're looking to kind of like get things done, and we know what we want to get done. We don't want to space things out. You know, we want to keep it efficient with recovery. We've all got to get back to our lives, and then the financial benefit is definitely a thing as well. So combination procedures are really just the way to go.
Interesting that it's cheaper. Is it because there's only one anesthesia then, rather than multiple?
Correct. So you walk in there, you know, like I say, it's just a nonstop flight, so we're not opening up more gowns and gloves. Not that those are super expensive, but there's no turnover time. You know, if we're doing 2 cases, usually, you know, there's at least 30 minutes between the cases. So it's just, it truly is just a very streamlined way to go. You know, someone goes to sleep and we just, you know, move forward. So it does save a lot of time.
Can I add something?
Please.
I think necessity is the origin of invention. So the origins of plastic surgery are really reconstructive surgery. And when we had to do these procedures that were extended and involving multiple parts of the body, over time, we learned how, and as a profession, how to do them safely. And that's first and foremost for plastic surgery. So as the surgical profession and the anesthetic profession progressed, it became more available to do on an elective basis as well.
About how long does it take to do, does it depend on the surgery or on the procedures, or does it typically take, you know, 3 or 4 hours to combine multiple into one?
Depends on what you're doing. So it depends on the surgeon, depends on the assistants you have. That's a big one. That depends on what procedures you're doing. Everybody's a little bit different. In general, I prefer to keep surgery under 5.5 to 6 hours. And so whenever I'm seeing a patient and they want multiple procedures, I'm thinking in my head, how long is all of this going to take, right?
So why is that the cutoff?
For me, it's about, I like to keep the anesthesia time low as possible. Complications go up once you go past a certain amount of time. A lot of my procedures are outpatient, so they go home. And so I'm just more so thinking about 6 hours for me is a good cutoff, because it's a little bit, it's kind of a little bit long, it seems, but that's the time that I found is a happy zone where people can go home, they wake up really well after surgery, and then complications are low. So that's kind of where the happy medium I found.
Yeah, I agree.
And Dr. Bank, you were nodding. Did you have anything to add?
I think you're asking about the duration of these typical procedures. It really varies between patients. You know, a breast lift on one patient is very different than the next. A tummy tuck, you know, can vary tremendously depending on the amount of skin, the amount of fat that you may need to remove. So I think, you know, in planning surgery, that has to enter the discussion, and it goes along with setting expectations, including recovery and so on.
Dr. Wuba, combination procedures like the mommy makeover, which is one of the most prominent surgeries that are really made up of a collection of procedures, In your practice, have you noticed that more patients are now asking for these combination surgeries?
Absolutely. A big part of that is social media. You know, there is so much information out there. There are Facebook groups. And when we think about the mommy makeover, we think a lot about what has changed from childbearing, pregnancy. And oftentimes it's at least the breast and the abdomen. Occasionally you may see a person who just wants to focus on the abdomen, but usually it's like people are like, this is all the things that have changed as a result: breast, abdomen, vaginal area. And so with the true mommy makeover is really a combination that looks at all the parts of the body that have been affected, and it's usually more than one.
And it varies from person to person, right? Like someone might want liposuction, someone might not. So does it vary?
Exactly, it varies. And so occasionally patients come and they ask, what does it involve? And I'm like, well, it's different for everybody. It depends on what do you feel has changed as a result of pregnancy that you would like to be improved. And that answer is completely different for every single person. So some people, it could just be breast. It could just be a breast lift, and that's their mommy makeover. For some people, it could be breast lift, circumferential lipo, tummy tuck, vaginal rejuvenation, so it kind of depends on the person. So it's very individualized. It's like a menu, in terms of your personal menu of what you want to be improved or what has changed.
And which procedures are the most popular to combine in your practice, whether that is body or face?
The most common combination for me, I have two common combinations: tummy tuck and breast rejuvenation. So abdominoplasty as well as a breast lift, or abdominoplasty with breast lift and augmentation and some liposuction is probably number one. And then number two would be abdominoplasty or something, abdominal contouring and vaginal rejuvenation. Those are kind of my two most common combinations in terms of the mommy makeover.
Very cool. Dr. Bank, one of your areas of focus is breast reconstruction, which can vary dramatically from patient to patient. What would you say makes for a truly great, aesthetically minded breast reconstruction?
That's an age-old question that I probably am not able to completely answer. There's a component of once you see it, you know it, but then there have been endless studies trying to figure out what makes the ideal breast. Mathematical equations, comparing things to the Fibonacci spiral, which relates to the golden ratio, various numerical measurements, but then there's a component of some artistic view and like an eye that even a layperson can see. One of my mentors in training, I was just say there are two types of plastic surgeons: one that sort of rely on the measurements and the numbers, and ones that kind of freehand things.
And which are you?
Well, I don't agree with that. Those two extremes. I think we all live on some kind of a continuum of that. So I go back and forth. I say, okay, these are the numbers that I'm supposed to get to, but if it doesn't feel right, then it probably isn't. And I'm not the only judge in the room. Okay, there's a PA, there's a circulating nurse, a scrub nurse, an anesthesiologist weighs in. So there's a whole jury of people to decide what things feel like.
Totally centers around the patient's desire, actually. So we can provide guidance, but I'm sure we all see patients who come in for secondary revision work and aren't happy with kind of their appearance from the primary work. And that may be because at the time of the mastectomy, sometimes there are limiting factors, and there's much more healing and recovery that goes into the primary procedure. And I see quite a few women who come in after that. They could come in 6 months later, they could come in 5 years later, but they're like, this is, not really, I'd like to see if I could do something different. And that could be bringing up their size or bringing down their size or getting them to match on the other side. So, doing a breast lift, maybe putting an implant in the non-cancerous side just to get that cleavage look that you get with the implant on the reconstruction side. So I'd say, we certainly offer guidance, but it's always about, what the patients ultimately want. And some, some women don't want reconstruction at all, and that's just the way it goes.
Right. There's no one golden standard of beauty. It's subjective.
Sure.
Well, I think one maybe exception to, sort of side note to that, and you alluded to it, is symmetry. I think one of the functions of the breast is to be symmetrical to its counterpart. So that's a challenge because we're not symmetrical structures, we're not static structures. Right. We change over time. Breasts that have been affected by one process or another are going to be different. And I would say, it's almost like a lifelong maintenance kind of a thing. So that needs to be part of the consultation, both on the reconstructive but also on the aesthetic side.
I heard one surgeon say once that the breasts should be cousins or sisters, but not twins.
Sisters and not twins.
Yes.
That's I think that's it's just to set the bar low, I think.
Dr. Chermak, when you combine multiple procedures into one surgery, does that mean that the recovery will be more intense since you've performed many procedures into one?
Some of the procedures are not onerous with regard to recovery, and definitely different procedures require different levels of recovery. I always feel like if you're going above the belly button, the recovery is not terrible. Like you can walk, you can drive, you can do non-strenuous things fairly quickly. It's when I think you start involving like muscle work in the abdominal area, or if you're going to be doing some type of thigh lifting type of procedure, then once you affect somebody's mobility, it's a little more, plus those procedures do tend to be more uncomfortable. So I think what we've been doing, like Amika talked about, trying to limit time, but I'd say, within that time, we do most of the time get our patients home by that evening. So we've been focusing a lot on pain management and trying to get away from narcotics. This whole country has been trying to get away from narcotics. We can barely even prescribe them anymore. So there's lots of really nice interventions that we can do to make the patients more comfortable after these procedures and get them mobilized better. And that's really important to their safe outcomes as well.
And if there are multiple healing sites due to multiple procedures, does a patient just need to kind of accept that their recovery might be a little intense for the first few days?
Absolutely. And we need to set them up for that. I think they need to understand that. And I think a very well-informed patient, as long as he or she knows that, they anticipate what's going to happen, it's way less anxiety provoking, scary, and probably even less painful, because people are just, it's that fear of the unknown. So I like to be really honest about, the level of discomfort that people will experience, and they appreciate that. I think I'd rather answer multiple sessions of questions with patients and have them go into surgery knowing, and that way they come out so much more comfortable and thankful for knowing that. I
also find that with there's certain procedures, as Dr. Chermak mentioned, when I'm doing, for example, an abdominoplasty, abdominal work, if we're adding a breast lift onto that, I tell patients, honestly, you probably will not really notice the breast as much because your focus is going to be on the muscle repair and that tightening. Or if you did liposuction on the back, that often takes precedence. And pretty uniformly, patients have told me, I don't even notice the breast. So there's certain things, like when you add a breast lift, for example, to an abdominoplasty, the recovery is not extended by that much, versus if you have a breast lift and you're adding an abdominoplasty, well, the recovery is going to be quite more substantial. And like you mentioned, I always tell patients, like, this is going to be hard, but I always say you can do hard things.
I agree. The lower back liposuction is intense.
That takes precedence over everything.
But I really think that it has a tremendous effect on the torso in 3D. And I always tell patients, you'll hate me for a week. At 2 weeks, you'll still hate me, but you'll see where I'm going with this. And at a month, you're like, okay, I got this.
That's a good one.
And so, Dr. Wuba, with more procedures in one surgery, does that mean that there's more risk as well?
So there is more risk. You're asking more of the body in terms of more sites to heal. So I always have patients increase their protein intake in weeks before and then after surgery, increase their water intake, keep sodium low. And so the risk increases because anytime you have longer surgery, more areas to heal, you're less mobile, there's more risk. So we think about blood clotting and things like that. So everybody has a different method in terms of how are they mitigating risk. I think it's important as you go into surgery, think about what are the risks and what am I actively doing with each step to minimize the risk of that surgery. So yes, but not substantially, but there is more risk just because of length of time and anesthesia.
And do patients have to be extra vigilant then with their recovery because there are multiple sites and multiple things to then look for?
Right, they do have to be extra vigilant. My question to patients is always, who is going to be helping you? That's a big one because your help can make or break your recovery. So I always find out who's going to be helping them, making sure they have really good support systems in place, and just being vigilant, watching things, making sure that we're staying on top of things. I think it's very important for patients to know that we're there and to call us with any problems. You know, and I always say, if you have any questions at all, just call us. I'd rather you call and it's nothing than you wait and it's something. But it does take some extra vigilance, but it's really like, for example, if you have an abdominoplasty in a breast, it's about checking one more area, you know, each time you change your dressings or when you're taking a shower. So definitely more vigilant.
Dr. Bank, when it comes to breast reconstruction, every case is unique. Do you often need to combine procedures or techniques?
Yes, and frequently there are breast reconstructions I do that incorporate multiple aspects of plastic surgery. So it kind of keeps me thinking and keeps things interesting. A lot of types of reconstruction I do are natural tissue reconstruction, autologous reconstruction, where we do transplant tissue from elsewhere in the body, like the lower abdomen or inner thighs, to the breast area to reconstruct breasts out of natural tissue, versus implants, which are also done extremely frequently, or combinations thereof. Now, in this day and age, which is different from 30 and 40 years ago, the goal is not just to reconstruct a breast. We want to reconstruct a beautiful breast. And sometimes it's even more youthful or beautiful than the original one. And I don't think we can neglect the rest of the torso. So in this day and age, I want my reconstruction patients to look like they had cosmetic surgery, or as if nothing ever happened at all. So we will plan breast reduction patterns or breast lift patterns into the mastectomy. The transplanted tissue, say from the lower belly, will mimic a tummy tuck. We'll plan the scars in that way. At a secondary procedure where we're revising the reconstructed breast, I'll frequently be quite aggressive in terms of liposuction on the torso, the abdomen, and the flank and back area, in order to improve the contour of there and utilize that fat for fat grafting into the chest area, to camouflage any contour issues or symmetry issues or volume issues as a result of the mastectomy, radiation, or just the natural healing process. So I think it's very important to create a holistic appearance to the body, and I think that's part and parcel with what we do, and sort of combines the reconstructive and aesthetic continuum.
Yeah.
Our aesthetic work informs our reconstructive work, and vice versa, because when we're doing sometimes revision work, you know, we bring in our reconstruction knowledge to just kind of recreate the actual anatomy. So I always find, I love that doing both, really, they feed each other in a very positive way.
Do you find that your patients bring in inspo pics, like inspiration photos for what they want to look like, or do they mostly just want to be restored to what they looked like previously?
It's a combination. I think I'd say by and large, social media has affected it, and the various social media platforms lend themselves to different sources or resources for patients that may choose one type of social media versus another. So Instagram, for instance, very visuals. Frequently I'll get before and after to make me look like that. This is somebody that's similar to my frame. She had implants that she says are so-and-so. I said, okay, but you know, you're also looking at a very small Instagram picture that who knows what effects are incorporated into the final image. So, you know, I say there's real life, and then there's Instagram.
It's good with guidance.
Yeah,
it's good with guidance, but yeah, you'll see people with, you know, facial structures that just don't match. They'll bring in Jennifer Aniston and say, I want her nose, and be like, yeah, of course you do. But, you know, you just have to kind of like set, kind of, it's really good for giving us guidance. But I mean, oftentimes people are comparing an apple to an orange, and you gotta kind of,
You have to tailor it.
I think it helps too to know where they're at mentally, because patients will come in to see you and they're describing what they want, but they have something in their head. They've already decided what they want in their brain, and and I'm always like, I really want to get that, and so it helps you to know where they are and how unrealistic or realistic they are. And sometimes you need to reel them back in, but you wouldn't be able to do that if they didn't bring in this, you know, picture of J-Lo as their inspiration pic.
Have people done that before?
Oh, absolutely.
And you know, I think what we're saying is that, you know, this is why you want to come to a board certified plastic surgeon. You're going to have that conversation. We have all the tools in our belt. You know, we're not, you know, hammering every nail with the same hammer. It's just, you know, you could go to a spa and get something, you know, get your lips filled to a certain level, but, you know, we do it to a different, you know, level, and you got to individualize and customize and inform and be safe.
Now, how many procedures can you safely integrate into one surgery? We mentioned that it's usually an anesthesia time of about 5 hours, did you say? 6. Yeah. Do you go based on timing, or do you go based on number of procedures, Dr. Shermack?
I mean, I'm always trying to consider safety in the patient. So, you know, one patient group that we work on is massive weight loss patients. So patients who have sustained sometimes greater than 100 pounds weight loss. And the consultation, I'm pretty proud of myself, like how I can run through all these body regions at this point, but really almost like head to toe. You might be covering things like facial deflation, neck sagging, you know, breast deflation, sagging, excess skin of the abdomen, arms, and thighs. So you're literally head to toe. And then you have to kind of come up with a staging, you know, plan. And sometimes people want to do, like I said, as much as possible, but then you have to kind of balance safety issues. And some of the patients have like low blood levels just from nutritional issues related to their weight loss. So you have to think about, like, if they're starting with a kind of gently low hematocrit blood level, you can't like risk blood loss and send them home at the end of the procedure. So I think, you know, it depends on how complex the procedure is that you're performing. Personally, I like to kind of address body regions. So, you know, if somebody is like a head to toe, we'll talk about like maybe doing the breasts and the arms at one time, doing the abdomen, back and thighs at one time, having a good assistant. You know, we're there as we should be from start to finish, but it's really nice to have an assistant help us close the wounds, and that's really someone who's experienced with doing that. They're not conceiving of anything, they're just helping the case flow, and they're professionals. So yeah, I'd say it kind of depends on the case. Like if you're putting a breast augmentation into something, it's not going to require that much. But if you're starting to talk about doing an arm lift and a tummy tuck, that's a different story. So yeah, we really have to figure out what their priorities are. Again, it's all about their priorities. I might be looking at someone thinking, you know, one area kind of is pretty dramatic to me, but they're like, want to address something different. So it all goes into that consultation and figuring out how much they want to do, how much time they can take, how much they can afford if it's out of pocket, and making sure we just kind of bring that all together into a good surgical plan.
Yeah, it sounds like there's a lot of strategy there for these types of combinations. Dr. Wuba, are you finding that your patients, that combination procedures are more common for facial plastic surgery or for body? We talked a little bit about the mommy makeover, but are you also performing a collection of procedures for the face?
I am. So oftentimes patients come in, and some patients come in and they say, you know, I want a facelift or I want a neck lift. And sometimes they say, I don't like this about my face or my nose, and what all can we do at one time? So I do find that quite a bit. And so we may do upper lower eyelids, facial fat grafting, facelift, neck lift in one setting, and focus on those different parts of the body. I oftentimes will do a rhinoplasty and breast surgery. That's a really common combination for me. Yeah. I'll do a facelift and vaginal rejuvenation. It's some interesting combinations. Yeah. So patients are really coming in and they're honing in on what they really. It's a time where people are really honing in on what they really want. And combinations are big because it's one recovery, especially when you think about people with families and, like, you know, you need help for an extended period of time. So someone else has to be off of work for some time to help. And so people are coming in and they're like, these are the two things I want to work on. Can I please do this together? So definitely I'm seeing a combination for face as well.
Got it. So you don't necessarily all combine like all the facial procedures into one or all the body into one. It could be whatever the patient wants.
Exactly. So you could do, I mean, you could do face and, you know, the extremes of the different areas of the body, you know, at once. It doesn't have to all be face or all be body. You could do breast and nose, face and vag, you know, so it's a combination.
And some people, like, you know, facelift has this still has a bit of a stigma to it. I would say we're seeing younger patients come in, but at the same time, there's the older patients who kind of grew up with, you know, the badly done celebrity facelift and the fear of that. And I see quite a few women who are very independent minded and they just want to get their neck done, for example. So, you know, I can see other things that might benefit, but they're not interested in that. So yeah, we really, you know, and we do combine, you know, a little bit of this and a little bit of that. The menu, almost like column A, B, C, you know, like what are we going to take?
Now, how about non-invasive procedures? Can you blend those in as well?
Definitely, you could do, because some, you know, I don't know anyone who likes needles, you know, so sometimes, you know, be like, they'll say, can I do lip filler at the same, I'll be asleep anyway, can we do some lip filler while I'm having my abdominoplasty done? So definitely, or microneedling to the face, which can be a little bit uncomfortable awake.
And peels.
And peels, so definitely, and those work really well in concert with facial rejuvenation, like facelifts and neck lifts. So for sure, a lot of non-surgical things happening at the time of surgical procedures.
When I approach these conditions, particularly on the face, I always think from the skin deep. So as many layers I can treat at that time, I think will give the best results. So, you know, there's pre-surgical care, post-surgical skin care, starting with sunscreen, retinols, and so on. But frequently we'll combine facelift with even a fairly aggressive laser treatment. We're doing more and more radio frequency energy for skin tightening and toning, so on, as for the body as well. So the more structures you can treat, the skin, the underlayers of the skin, the fatty layer, and occasionally the bone, I think you're going to have a better, sort of more harmonious result.
Dr. Shermock, any final thoughts on why add-ons or combination plastic surgery is becoming so popular?
I just, you know, I agree there's lots of social media support groups and people are understanding what they can get done, and celebrities are starting to come out and admit things that they've had done, and I think things are becoming less stigmatized. I'd love to see some things become even less stigmatized. Things like labiaplasty, for example, is a really important procedure. But at any rate, I would say, you know, personally, like I actually had a combination procedure last year, and it was just like the best thing because I'm done. I mean, and I can move on. I like got back to work, and that's it. So I think we tend to care for caregivers when we're talking about these operations, particularly like the women in the family. I mean, you know, I want to be as PC as possible, but generally, you know, these women are the ones taking care of everybody else. And so when they want to take their downtime and plan for coverage, which is something you do need to assure, you know, they just want to kind of like take the time and be efficient about it and plan. I mean, you know, they're kind of like the heart of the family. And when they want to step back a little bit, you know, they just don't want to take too much away from the family. So.
Yeah. In light of that, is there a time of year that's most popular for these types of procedures?
I would say summer is popular. It's always kind of busy, you know. But I'd say summer is popular because the kids are off of school, and so there's less to coordinate with the drop off and the pickup. And then teachers, you know, so things like that. Like a lot of teachers have their procedure, or therapists, people in the school have their procedures done in the summer.
And some people like the holidays, some people don't like the holidays. You could flip that argument either way.
I was going to say holidays because you would have so many family members around to then take care of the children if need be.
I think the hard part is that then you're not able to enjoy Thanksgiving.
Right, so it's either way,
It's got to fit.
Double-edged sword.
Yeah.
Any final thoughts, Dr. Nwuba?
Like I agree with everything. You know, it's becoming a lot more popular. A lot of people want to have a one and done situation and don't want to have surgery thinking, okay, now I have to plan for the next surgery. And so it's a thing where people are like, how many things can I get done at once so I can just, this thing I've been thinking about for a long time, but while we're there, can we just add this other thing that I think is going to take everything, you know, kind of top notch. The other thing too, that people are realizing that if they do one thing, then they will start noticing something else a little bit more. So for example, if you have very large breasts and maybe your abdomen didn't bother you because you didn't really see it because the breast covered it, they start imagining well, if I reduce my breast, well, suddenly I'm going to notice this more. So I think people are more educated coming in, but also being more conscientious of how one tweakment is going to affect another part of the body.
Great. Well, with that, we'll close. Thank you so much, surgeons, for your time.
Thank you.
Thank you.
Thank you.